Good morning, everyone. I'm Dr. Prathama Chaudhary, consultant psychiatrist, Kolkata. Today, I will be speaking about senior citizens and their emotional wellness during the coronavirus pandemic. As cases of COVID 19 soar around us, we are in the midst of an unprecedented situation. Every day, we battle with the fear of contracting a deadly disease and grapple with practical difficulties of running our lives. Difficulties that involve doing all household chores that we would normally delegate to our domestic helps, of losing jobs and getting pay cuts, of not being able to fix a leaking tap or a broken down water filter, and managing frayed nerves in general. This is even more difficult for the elder citizens. They are frail and often ill. Many of them have an associated medical illness like diabetes, chronic lung or kidney disease, or high blood pressure. They badly need medical care on a regular basis, which is difficult to get by in times such as these. Even if they're medically okay, the seniors often have problems with vision or hearing. Their reflexes are slow. This gets even more complicated if they have neurological illnesses like Parkinson's disease and so on. Many of them cannot grasp concepts as easily as they used to do a couple of years back, which adds to their frustration. Problem is, even we don't seem to understand that it is normal for them to take in things a little slowly, hence, they ask the same questions many times over. We snap at them, and they feel let down, often shedding silent tears. Not everyone is lucky to be living with an extended family. They have to depend on their domestic helps for a lot of things. But now, understandably, very few domestic helps are likely to report for work. So, it is left for an elderly man or woman to cook, wash, or go to the market and call the plumber, all unaccustomed, hence very difficult chores. A 65-year-old lady called me up yesterday. I used to treat her daughter once. She desperately wanted some sleeping medicines and, more importantly, I suspect, some sound advice. She stays with her 70-year-old husband who suffers from hypertension. In the absence of any helper, she does all household chores. It takes her hours to do them. Now she suspects her husband's blood pressure is shooting up, the way he snaps at everything. But how will she check? His doctor has politely told her not to come to his chamber unless it is an emergency. She worries then it might get too late. How will she go to the emergency room anyway, now that her driver is not reporting for work? These are all tough questions, aren't they? And add to this the lack of updates and timely information. It is difficult for us, those of us who are flooded with information through the internet every day, to appreciate that these people do not have the know how and dexterity to access the internet as easily as we can. The information they manage to get is often inadequate and, more dangerously, wrong. People tell them, you have to be careful, times are bad, you are at high risk. All good natured advice, but if delivered with the right amount of sensitivity, they can dampen already sagging spirits quite a bit. So, what can we do for them? Tell them and make sure they feel that it is just physical distancing we are talking about, not social or emotional. Keep in touch. Maybe one or two phone calls a day. Chat, lighten the mood, ask if they need anything which can be delivered at their doorsteps. If their credit or debit cards are functioning all right, if there is enough money at hand, do all this with delicacy and tact. And while you are at it, ask casually if they are developing any physical symptoms of any illness, not just COVID related ones. Please don't forget to assess subtly if they are talking less, withdrawing into a shell, not looking after themselves well, or having difficulty sleeping or eating. All these could be symptoms of giving up or having depression. A mild tremor in the voice or of the hands, which has not been there before, forgetting things, and not sleeping well, could also be symptoms of anxiety. Assure them that help is at hand. Medical help is just a phone call away. Psychological counseling and psychiatric consultation can be done online or over telephone. You may not be able to take them to the doctor, but conference calls are always possible. Just providing information is often not enough. You may have to shepherd them. If necessary, accompany them to the place of help. Helplines for senior citizens are active in the city. Please do not hesitate to take help if your old man is stranded in another city all by himself. Let them exercise daily, eat healthy, and sleep through the night. Being a senior citizen and having an associated medical illness do not necessarily mean they are doomed. Give examples of elders battling coronavirus successfully if you have to. Above all, don't forget that the elderly love their sense of independence. Do not treat them like babies. Involve them in decision making. We have a lot to learn from their wisdom, more so when times are so stormy. I hope this talk helps some of you out there in this time of crisis. If you ever feel you need some help regarding this, please feel free to contact me at 98312 51629. Thank you for listening. Dr. Pratima Chaudhary, Consultant Psychiatrist, Kolkata.